The outbreak and rapid spread of the COVID-19 pandemic necessitated an urgent need to upscale implementation of universal health coverage to all our counties. Towards this end, Mr. Speaker, I have proposed an allocation of Kenya shilling 121.1 billion to the health sector to support the various programs aimed at improving health outcomes. Mr. Speaker, of this amount, Kenya shilling 47.7 billion will fund activities and programs for the attainment of universal health coverage. Mr. Speaker, specific allocations for the various activities and programs includes Kenya shilling 8.7 billion for the Kenya COVID-19 Emergency Response Project, Kenya shilling 4.1 billion for free maternity health care, Kenya shilling 7.2 billion for the managed equipment services, as well as Kenya shilling 1.8 billion to provide medical cover for the elderly and severely disabled persons in our society. To lower cases of HIV, AIDS, and malaria and tuberculosis in the country, Kenya shilling 5.8 billion has been set aside. To enhance vaccines and immunization program, we've set aside Kenya shilling 3.9 billion. Further, Mr. Speaker, we propose an additional Kenya shilling 14.3 billion for purchase of COVID-19 vaccines and related expenditure in the course of the financial 2021-2022. Mr. Speaker, to enhance early diagnosis and management of cancer and reduce the burden of treatment among Kenyans, I have proposed an allocation of Kenya shilling 450 million for procurement of cyberknife radiotherapy equipment for Kenyatta University Teaching, Referral and Research Hospital. A further Kenya shilling 350 million has been set aside for the establishment of 2 cancer centers in Meru and Kakamega. Further, to improve health service delivery, Kenya shilling 15.2 billion has been set aside for Kenyatta National Hospital, Kenya shilling 11.5 billion for the Moi Teaching and Referral Hospital, Kenya shilling 7.3 billion for the Kenya Medical Training Centers, Kenya shilling 2.8 billion for the Kenya Medical Research Institute, Kenya shilling 1.2 billion for the construction of Kenya National Hospital Vans and Pediatric Centers, Kenya shilling 863 million for procurement of family planning and reproductive health commodities, in order to strengthen our healthcare system, make the cost of medicines affordable for Kenyans, and step up the fight against COVID-19 pandemic, I propose to introduce VAT exemption on medicament used in our health facilities, including decongestants and food supplements. Further, I propose to provide VAT exemptions to diagnostic and laboratory reagents, artificial respirators, including therapeutic respiration apparatus, breathing appliances, gas masks, as well as medical equipment and technologies used in the provision of medical care services. It is my hope that the suppliers of this medicament and medical equipment will reciprocate by making their prices affordable. Mr. Speaker, in order to promote local manufacturing of pharmaceutical products, I also propose to introduce VAT exemption on inputs used in the manufacture of medical ventilators and breathing appliances. This will enhance access to these products that are essential in management of the COVID-19 complications.